Hello, Gold participants from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I'm chatting today with Gail Tully about her upcoming presentation titled Illustrating Breech Complication. Welcome, Gail.
Hi,
So,
well,
Gail,
thank you. Thank you so much, Kristen.
it's so wonderful to have you here with us today. Gail, tell us a little bit about yourself and your professional journey and how this topic became of interest to you.
I became very interested in breech birth right away, even before I was a midwife, simply due to the birth where my friend was giving birth to her first child and the baby was breech and the midwife wasn't there. And, the birth fortunately went very well and it just ignited the interest for me. I've been interested in fetal positioning and helping posterior babies rotate more easily for those 30% that have difficulty rotating on their own. And I noticed um, when a breech baby in pregnancy flips head down, they often flip down posteriorly, and that became a clue about the uterus and potential torsion or imbalances in the physical uterus and how the baby would then be positioned to reflect that space and how could we add balance to improve the room for the baby so we make room and the baby then finds the best position with gravity. um, that's true for many breech babies, not all but many. And so I've grown in this area. Plus, I really love breech births. That's basically it. As a midwife, I love breech births. When they're easy, they are so easy, and I'm very interested in how, in my topic that I'm giving today. So I'll leave the rest for the topic.
And yeah, talking a little bit about your topic, you are presenting on breech complications. Um, Assisting in breech birth is almost become somewhat of a dying art. There's a lot of fear attached to breech deliveries or births. The hospital often resorts to C-sections. And looking at your presentation and your work that you've done, you say that doesn't have to be the case. So when you were shining light on the topic, what kind of barriers have you encountered?
Kristen, the most biggest barrier that we have about breech birth is that in discussing the value of technological birth, breech birth has become the big fear point. If a medical provider or even, it's the newspaper journalist, the literary writer, I mean, when they want to say birth is dangerous, they pick breech birth as the example of scary birth. And that's so unfair. Of course, it's terrifying if a breech baby is coming and becomes stuck and the provider doesn't know why the baby's stuck, how the baby's stuck, or what to do about it. But, that's the case with people who don't have the education is complications without knowledge are terrifying. But with knowledge, the fear is gone. And the biggest obstacle to promoting breech vaginal birth in this day and age is the ignorance and the choosing of breech birth as the bad event, Like, what should we be afraid of? We should be afraid of breech birth. And
Yeah.
it's locked into society's thinking. And it's so unfair. Women that have both head down babies and breech babies, when they have a provider that knows how to help them gently, they love their breech births. Easier, faster, less painful.
And you're so right when you say knowledge is power, and we're looking forward to your presentation to learn more about the subject. So that brings me to my last point for today. What do you hope our delegates will take away from this presentation?
I hope that we can break the ideology on both ends of the extreme. I don't want people to think that birth is so frightening that it should be banned and all breech babies should be born by cesarean. But I also don't want people to think that breech birth is totally normal and, hey, because it's normal, we don't have to have someone who understands very intimately how the baby's arms, shoulders, and head are moving through the pelvis, because that information is life-saving. So I want people to be practical and be confident.
Well, thank you so much, Gail, for chatting with me today. It's been an absolute pleasure. And to our listeners here, her presentation illustrating breech complications is available as part of the breech add-on and is available starting February 6, 2017 and will be available to view until March 31st, 2017. For more information on this presentation and the online midwifery conference, please visit www.goldmidwifery.com. Thank you all for listening and goodbye for now.